The Institute of Sport, Exercise and Health has been set up as an Olympic legacy project. It caters both for elite athletes, but also translates that to other people involved in sport and exercise. And most importantly, it's engaged in really trying to increase physical activity and exercise for the population in order to mitigate the effects of chronic diseases and inactivity and to improve the health of the nation. We treat a variety of conditions, be they acute injuries like a knee ligament rupture, for example, and at the other extreme, we're treating cancer, respiratory disease, diabetes, obesity, trying to get those people more active and reduce the burden of that disease and improve their quality of life. Patients have a multidisciplinary team around them. They can have their imaging, including MRI, X-ray, ultrasound, and then they are referred on for surgery at UCH.
This is a patient of mine who broke her leg 18 months ago. She's an elite level rugby player. Although it went on to heal uneventfully, we established that she formed a chronic stress fracture, and so we undertook an operation to treat that stress fracture. Unfortunately, she had some irritation from some of the metalwork we used, and so today we've removed the offending article. She'll be able to walk on this pretty much immediately. She'll be seen by a physiotherapist and hopefully go home later today.
I'm feeling good actually, legs not too painful, feeling confident. I want to get back to rugby this summer and play some sevens. That's my ultimate aim.
GPs can refer directly to the Institute of Sport, Exercise and Health by referring to the orthopaedic and sports departments at UCLH.
Hi, how are you?
Really good actually, yeah. I was taking my dog for a walk to the park and I tripped over another dog and I knew I'd done something really bad to my arm. So I was then referred to UCH. After the operation, I thought I would go back to the main building, and then when I was given this letter going to 170 Tottenham Court Road, I thought, this can't be it. But it's a comfortable place to be, it's been great.
Tell me when to stop.
Now.
It's starting to get a bit stiff.
I've been here to see the consultants, just to see how I'm getting on with physio, which was fine.
Push up to the ceiling. So that feels good and strong, and that's the tendon that we repaired.
Oh, good.
Many sports injuries will come through at the weekend, so we've created a fast track through accident and emergency so that they can be treated here and enter the same pathway.
I would say I'm a very enthusiastic club runner. I run every day, it's a really important part of my life. I've developed an acute tear of one of my leg muscles. When I came here, I was examined by a doctor, very thorough history, went through my running background, my injuries, and the rehabilitation's been excellent. The last thing you want to do if you're a keen sportsman is to just stop. So you want to be doing as much as you possibly can, and they understand that here and they encourage that. I think within a month I was just able to run the London Marathon. Not at my fastest time, but it was fantastic to participate and had a fabulous day.
We're pretty proud of what we've achieved to date. Awful lot of work still to be done, but I suppose the things that excite me are the partnerships that we are starting to form with national governing bodies in sport and different sporting organisations. We have Extreme Everest that are based here, which is a very, very exciting project, and the team are based here using the facilities, doing their research.
One of the biggest common factors between patients in hospital, especially those who are most ill, is they have low oxygen levels in their blood. We are very much interested in trying to help them, whether you try and increase the amount of oxygen in their blood or maybe try and increase their efficiency with the oxygen that they have. And the only way we can actually go about testing that is by testing healthy subjects using hypoxic chambers like this one. Today we've got Josh in the chamber. We've got him doing a cardiopulmonary exercise test. We're measuring lots of different parameters, heart rate, amount of oxygen he's taking in, carbon dioxide he's blowing out, and we use tests like this to work out what happens to people in low oxygen environments.
Just one example of where the Institute can add real benefit into our population health is we're working with the council at the moment on a project involving really increasing the physical activity of young children in schools. The children themselves have designed a playground, so there's 7 different designs in 6 schools. And I think the lovely role that we can play is that we're going to be giving a very scientific, robust analysis of which playground had the most effect on getting the kids most physically active, which I think everybody can imagine is a very important project.
Being part of this organisation is extremely exciting. It's something we've worked towards for a long time, and it really has been an opportunity to bring together some of the best clinicians, some of the best scientists, some of the best researchers and some of the best teachers, and the outputs are far greater than any of us could achieve individually.